So today we're talking about Medicare Part D. That's the prescription drug coverage, or called a PDP, a prescription drug plan. We call it a lot of different things. It confuses the daylights out of people. I'm well aware of that. The average consumer gets at least 10 commercials a day, or 10 advertisements between the mail that they get and watching on TV during this period of October 15th to December 7th. And they've got all these messages. They're similar. A lot of them are talking about Medicare Advantage, or they're talking about some particular benefit on Medicare Advantage. Few of them really break down the prescription drug plans and your coverage under Medicare for prescription drugs. And you definitely have some decisions that you need to make during this period of time. Unfortunately, most people can't tell me what they are, okay? And you just watch these commercials. So what I'm going to do during this video is try to just lay out the whole program and then give you enough information to zero in on the decisions that you need to make. So your Part D, you receive that from a private insurance company. You don't get that directly from Medicare like you do Part A and Part B. So you're going to get this from a private insurance company like the Silver Script that comes from CVS or from Humana or United Healthcare, AARP, just to name some of the big ones. They're private insurance companies, but they're offering a Medicare Part D plan. And so what the government does is they have this standard minimum benefit. So they lay out, the Medicare people, the CMS, they say, okay, so this is the standard minimum benefit that you insurance companies need to have in your Part D plans. And so they have to be at this at a minimum, but the reality is most Part D plans offer something better than the minimum benefit. So they enhance this because they want your business. They want you to do business with them, and the government is sending the private insurance company a big check behind the scenes every month to offer the Part D to them. So that's what they really want. And then they also want your premium that you're going to pay for your particular PDP that you choose. And then the pharmacy, you're going to get them at the pharmacy that they've made a deal with. So the private insurance companies are behind this, but it's really Medicare behind the whole scenes. And most people really have a hard time explaining what their coverage is, or they experience it. It's like they go to the pharmacy at the beginning of the new year, and it's like the lottery. They're just wondering, are they going to ask me for 30 bucks, or are they going to ask me for 300 bucks? And when it's 300 bucks, people tend to get pretty angry. I mean, we have about 4,000 of these things in force. We have 5,400 customers on Medicare coverage, but about 4,000 individual PDP plans in force. We don't get too many complaints because we do a pretty good job of placing these things properly with the people. So the standard minimum benefit, what they call for is a $480 annual deductible. That'll be on the 2022 plans. And so that just means the first 480 bucks of your drugs are on you, okay? And then after the 480 bucks, Medicare then will pay, or the Part D plan will pay 75% of the cost of your drugs. You pay 25% until you reach the coverage gap, commonly referred to as the donut hole. And we had some discussion getting ready for this video, is a lot of people are not even aware that the donut hole was, at least as the government calls it, closed at the beginning of 2020, but that didn't mean you have no costs in the donut hole. It just meant, it's confusing. The coverage is really, once you get in the donut hole, the same as it was before then, but you still have a pretty big cost. And then as soon as your total out of pocket reaches $7,000 or $7,050, then you go to 95% coverage, and there's a point where you could get the whole thing covered. So if there's any one area that people get frustrated with with Medicare, it's this stuff. Some of that is due to their decisions that they made the prior year to get ready for this. Some of this is on the people or on you, but much of it is really around confusion around the whole program and how it works. So I'm not going to try to get into details today so much as I'm trying to give you a general overall. Now, these PDP plans, when you get down to the actual plan that like Humana offers or United Healthcare AARP, they're going to offer you coverage that's better than the standard minimum benefit. And the way they do that is they either have a lower deductible than the 480, or they have a zero deductible, and perhaps the zero deductible is only for generic drugs and the two-tiered drugs. But many people do not incur this deductible depending on the plan that they get on, and the companies can set that wherever they want to set it, as long as it's not more than $480. The second place that they deal with this is they give you co-pays instead of 25%. And so most of you are familiar with a $2 copay or a $6 or a $10 or a $20 or a $50 or more. But it's just a fixed dollar amount out of your pocket, and it doesn't add up to 75%. It's much more easy for you to understand that. You pay every time you get the prescription filled. And then they work with this thing of network pharmacies. So these plans will make deals with the larger pharmacies, and they'll call them a network pharmacy. So you're going to pay the least if you go to the proper pharmacy, and more if you go to one that's not a participating one or possibly not have coverage at all. So the actual plans are better than the standard minimum benefit. And then, unfortunately, many people evaluate these PDP plans or prescription drug plans just by the monthly cost that you pay out of pocket. And we've got them like right in the zip code where I live, as low as $6 a month for a prescription drug plan, and as much as $50 or $60 a month. So if you're just looking at the monthly outlay that you kick out yourself, most people are going to choose the $6 plan. And if you're taking a lot of drugs and you're really worried about a lot of out-of-pocket, you might just be inclined to buy the $50 plan, thinking it's going to pay better than the $6 one. And that's not always, it's not a good way to make decisions about this stuff. When you're picking plans, which you get to do from October 15th to December 7th, it's wise to look at the overall costs for the next year. How much are my drugs, what is my true out-of-pocket going to be? So how much am I going to pay by the month for the plan? And then what are my co-pays going to be? And what about the donut hole and all that kind of stuff? What is the annual cost of being on this particular Part D plan? And we have software, and you got to know how to use the software to enter in your drugs. So my guess is most of you are not as concerned about everybody in America as you are concerned about your situation with prescription drugs. And so what we do is, if you send us a list of your drugs, how often you take them, what the amount of them is or the size of them, what the name of them is, and then the whole list of them, and we plug that into the software, and then where you like to buy your drugs. So if you have a preference of a particular pharmacy, we're going to plug that in and go into the software, and we're going to look at all the PDP plans that are available for you in your zip code, and it's going to show you, it actually rank them by the out-of-pocket costs, the total cost of just the drugs or using them and the monthly premium. And that's an intelligent way to select the stuff. It's also very enlightening because many people just see in advance, this is going to cost me a lot of money next year. But at least we're going to be picking the plan that's going to make that number the smallest. And then the variance between plans is high. So you've got this standard minimum benefit or the structure. The plans themselves are better than the minimum. And then the plans vary. They all treat things differently. The monthly charges that you pay for those are different. You can also have penalties. If you didn't sign up when you were supposed to sign up, you had a period of time not covered, you're paying that penalty now. Then you've got, for the high income people, you've got an IRMA surcharge on your prescription drug costs, and that'll show up in your charge for the thing. Then we haven't spoken about formularies yet, and that's probably the only word that not everybody will know what I'm talking about. But a formulary is a list of drugs that are covered by the plan. And there's really strict guidelines that they have to cover at least one drug in every treatment category. So, but you need to pay attention to this, and specifically with your drugs, are they covered on the formulary of the plan that you're wanting to purchase? I mean, are they covered first, and then what tier are they putting them in? So I don't want to get into too much detail on this, but you know, most of these plans have like tier 1 or generic drugs. That's what they want you to buy, and that's what it's going to be with your least cost. Some drugs, some people can't take the generic. Other people don't want to take the generic. Then they got tier 2, which is the preferred brand name drugs. That's a brand name drug. It's not a generic, but they have a negotiated price through the network pharmacy that's acceptable. And then tier 3 is going to be the non-preferred, which just means that it's a drug, it's a brand name drug, but it's not on their best pricing list. So you're going to have probably a much larger copay for this, possibly even have to incur the deductible. And then the tier 4 are the biological things and just the very expensive drugs, cancer drugs. And this is where we try to do our best work, in helping people pick a plan. And sometimes we get into writing to the manufacturers or contacting them to get on a scholarship program. Based upon income, they'll help people with extremely expensive drugs. But in any case, each one of these plans is going to have a different formulary, and we can go in there and look at that, or we can just plug your drugs into the software, and we can anticipate how they're going to be treated by all the different particular plans. So you use it in making a decision. You've got several categories that people think, it's really this non-prescription drugs. These Part D plans are not going to pay for you to go buy aspirin or over-the-counter stuff. Some of them have like an added benefit where they'll give you some reimbursement or give you a card you can use at the pharmacy. But by and large, there's a whole list of stuff that's not covered under Part D. So why are we teaching this to you today? I mean, we're teaching it because you need a certain amount of information to make decisions about what you're going to do during this period of time. I mean, it's that simple. And you don't need too much information. You just throw your arms up and just buy one or keep the one you got. So we're giving you enough information to get in. What you really need to do is get access to the software with a user of the software that knows what they're doing to make a recommendation. And you can certainly get that from us. We work in all 50 states and the District of Columbia. We do that by phone. We can get on a Zoom with you. You can send me an email with a list of your drugs. Now, another point that I want to make with this is that people that are on Medicare Advantage plans typically don't spend a lot of time looking at the Part D plan, which is part of that Medicare Advantage plan. So in other words, if you go the Medicare Advantage route and you're on that, you're just going to get whatever drug plan comes with that. And you're probably evaluating that by the medical and hospital benefits. If you're on original Medicare and a Medicare Supplement, then this PDP business is something that you buy directly yourself. Now, the bad news on that is you got to pay the monthly premium. It doesn't come for free along with the Medicare Advantage plan. The good news is you get to actually pick your PDP. So when we try to do that with Medicare Advantage plans that include a PDP, where people are not happy with their drug coverage on their Medicare Advantage plan, we can still go back in and find a Medicare Advantage plan that has a more suitable drug plan attached to it. But now we have the PDP tail wagging the Medicare Advantage dog. I mean, and so generally that's not smart business to be picking your Medicare Advantage plan entirely by the PDP. It's something to look at. So we provide Medicare consulting all over the United States. Love to hear from you. I'm Hans Scheil. Thank you for listening.